Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites viewmedicaldoubts.blogspot.com and radhavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary for the medical knowledge to general people and for reference to medicos. Today I am going to discuss about the Pruritus Ani. It is an intractable itching around the anus. The skin is white and hyperkeratotic and may become cracked and moist. The reasons may be several like lack of cleanliness, excessive sweating and wearing rough or woolen clothing. An anal and perianal discharge which keep the anus moist. The causative lesions include an anal fissure, fistula in ano, prolapsed internal or external hemorrhoids, and excessive ingestion of liquid paraffin. A vaginal discharge, especially due to Trichomonas vaginalis. Parasitic causes, threadworm, Enterobius vermicularis should be excluded, especially in young subjects. Scabies and pediculosis is pediculosis pubis may infest the anal region. When the anal skin shows some form of deformities which has a well-defined border, mycotic diseases of the skin due to yeast and fungi should be suspected. Microscopic and culture examination of mucopus taken from the region are necessary to establish the diagnosis. Allergy. Allergy may be the cause sometimes. In this case, there is likely to be a history of other allergic manifestations as urticaria, asthma or hay fever. A raised pH of feces. It appears that the incidence of perianal dermatitis varies with the pH of the feces. The more acid the stool and the perianal skin, the less the frequent is the occurrence of perianal dermatitis. Psychoneurosis. In few cases, the neurotic individuals become so immense in their complaint that a pain-pleasure complex develops. The pleasure being the scratching. Possibly this is true, but such a syndrome should not be assumed without firm grounds for coming to this conclusion. Treatment. The first step is the treatment of the cause. Other methods are hygienic measures. Wet cotton wool is substituted for toilet paper. Soap is avoided and replaced by detergent. These measures combined with wearing cotton cellular underwear and application of calamine lotion or that is necessary to cure some cases. The following measures are directed to mainly those frequent instances where no obvious reason for itching can be demonstrated. The best sedative available is the alkaloid reserpine. 0.25 milligrams daily. This has a tranquilizing effect on many anxious patients but has no direct effect on the pruritus. Hydrocortisone. In cases with dermatitis and only in cases with dermatitis, prednisolone applied locally in a cream of 1% is often beneficial. Sometimes after discontinuation of the therapy, the pruritus is likely to return. In this case, 5% xylocaine ointment can be substituted. Strapping the buttocks after a part is a most useful procedure when the pruritus is acute and in chronic cases when the Opposing surfaces are moist. The strapping is worn so long as the patient finds it beneficial. Operative treatment. This is necessary when concomitant lesion of the anorectum which initiate or contribute to the pruritus. When other measures fail to bring permanent relief, the advisability of performing an operation to endeavor to rid the patient of the pruritus should be considered. In case of moist dermatitis, the operation is contraindicated. Cover leaf operation. Clover leaf operation consists of removal of a large piece of pruritic skin from each quadrant of the perianus. Preoperatively, a daily enema is given and sulfaxidine is administered orally for 5 days. Shaving is done after the patient is anesthetized. This operation is curative in majority of instances of otherwise refractory pruritus ani not associated with cutaneous changes. Some surgeons prefer to cover the denuded area with a skin graft. That's all about the Pruritus Ani, and in the next video I will discuss about some other disease. Thank you.